Hi everybody, Dr. Matt Walton here. One of the newest things we have in technology is our instrumentarium cone beam machine. Cone beam is basically a CAT scan machine like they use in medicine, but it's just a smaller field of view for dentistry. One of the things this allows us to do is envision x-rays in 3 dimensions versus the old way, which is 2 dimensions. It's helpful in finding diseases of the jaws, teeth, that sort of thing, and really helpful in planning implants. This here is our CT, or some people call it CBCT. It's basically a cone beam, a CAT scan image, a 3-dimensional image of the jaw. What this allows us to do is see depth versus just 2 dimensions. So we can rotate with just one x-ray, we can rotate all around. I can see the jaw from the front, from behind, upside down. You can see up into the sinuses here, versus in the old days we couldn't see any of that. We could only see in 2 dimensions. If there's pathology in the jaws, anything like that, we can more easily pick it up on here. One of the nice things that this does for us is we can virtually place a dental implant and it takes the guesswork out of all the procedure where we used to have a lot of guessing. So what we're doing here is we're virtually placing a dental implant. I can move it around different directions. I can move it up and down. I can rotate the jaw around in 3 dimensions. I can experiment with different sizes of implants, width, and diameter, and length of implants. What this does is it allows us to treatment plan this so that we can precisely place the implant and thereby avoiding important anatomical structures such as nerves, arteries, veins, and the sinus. A lot of people ask, is it necessary to have a cone beam image done? And I don't think it's necessary, but if I were having an implant placed, I would probably want one of these done on myself, especially if it's a more tricky situation. So with this, we can look at the bone, see how much bone we have. I can take away the bone, and I can even outline where our nerve is, marked here in red, so that when we place an implant, I know exactly what depth, what length, what measurements to do. I can turn it around so I can see the back side of the nerve running along the jaw. As you can see here, we've already placed an implant on the patient's left side here.